Hi, how are you all? Uh, Morning. This is my fourth day in quarantine and my third talk in the series Quarantine Positive series. I'm still asymptomatic. I'm feeling excellent and I'm feeling great, whoever has asked. Today's topic is actually speaking about the ankle somatotopy. This is actually points that actually Dr. Toshikatsu Yamamoto has found to be very, very useful for treating some types of disorders throughout the body, mainly pain. But I've also found in my clinic, it's also very, very useful for treating any types of internal problems, especially when they come into the clinic with these internal disorders. For example, maybe contraction of the heartburn, contraction of the lungs, difficulty in breathing, even PMS, and etc. So this is a somatotopy that are located on the area of the ankles, which can be used. I'm going to show you the points. Now we'll go ahead and speak about it. So yesterday's lecture, we spoke about points that are located on the area of the temporal and how to treat the temporal region. You actually have some type of not only treating headaches, but understanding that if we're working with the temporal region, we might have some type of effect throughout the whole body in one manner. And this is on the other edge of the body, which is in the area of the foot. And by treating the foot, you can treat other aspects of the entire body. So that brings us to tomorrow's topic. We will speak about the connection between the head and the foot in a case of mine, and you'll see the connection between acupuncture and a stronger connection to the connective tissue, the fascia and the connective tissue, and how they work together and bring very, very strong and very good results when you're treating your patients. So I'd like to speak about the first points that we're going to speak about. I like to call it what we see here in blue, okay, on the lateral side and on the medial side. These are called the soleus points. The soleus points are actually located in an area where the soleus muscle integrates and becomes more of the Achilles tendon, okay? So the area where the soleus muscle integrates and becomes more of the Achilles tendon, on the medial side, it's around kidney 7 and 8 acupuncture point. And on the lateral side, it's on around urinary bladder 59 point, okay? Now the difference between these two areas, okay, is the area in which it treats, or maybe the side of which it treats, of the palm of the hand, okay? The medial part, okay, around bladder 6, bladder 7, kidney 7, kidney 8 point, treats any disorders of the palm of my hand when I want to flex my hand or close my hand, or have difficulty in closing my hand. Any abnormality that's occurring when I'm trying to close my hand and I don't have a free flow in closing my hand, then I will needle ipsilateral. My left hand will be treated on the left soleus point. I'll use the medial soleus point. And what you want to do is you want to palpate the area of the soleus point, like I said, around kidney 7, 8, sometimes even a bit proximal or a bit distal, go up and down, look for a tender point there. And when you press on that tender point, ask your patient to close his hand. When he says that his hand is better in closing, he has a better influence in closing the hand, then you needle that point and leave the needle in for about 20 to 30 minutes. And at the same time, ask your patient to close and open your hand. It'll free up the hand more and also free up the point there. If you're not an acupuncturist or you don't wish to use acupuncture in that therapy, or your patient is afraid of acupuncture, you can even massage and manipulate that area for about 5 minutes. Okay, That is the medial part around kidney 7 and 8, which help you enclose in your hand. Okay, the next point, which is lateral, which we see here, which is around bladder 59. You can go again proximal, distal or proximal, search that area there, the Achilles tendon, and look for area which is painful for the patient when palpated. When you have located that area, same time, ask your patient to open your hand, okay? That point of the lateral side will influence the extension of the palm of the hand. So any problem in the extension, stiffness, pain in the extension, problems for the extension of the hand, that bladder of urinary bladder 59 area will assist in that. And again, like I said, you needle the point or you palpate the point and massage the point. At the same time, ask your patient to extend his hand more and more, and you'll see it freeing up. When you have trigger finger or Decker-Venn syndrome, generally you needle the medial and the lateral at the same time. Now, also these points were actually used first for spasticity. When you have hyperextension and actually you want to relax the extensors, okay? So you actually needle the area of bladder of kidney 7 and 8, which will cause more of a flexion and relax the extensions. When you have hyperflexion due to spasticity hyperflexion, and you want to release actually the flexors, then you're going to needle around urinary bladder 59 areas. So that will relax the flexors and allow more opening of the hand. Okay. When you have both, like you have these symptoms like this and this, you might sometimes want to do also the medial and also the lateral head points of the soleus points. So that's our first point, the soleus point. The next points, which I wish to discuss here, are what we can see down here, just below the malleolus, okay? Or what we have your brain. Brain is located at the center of the malleolus, the most sticking out point on the malleolus. And then below the malleolus, we have UB, which stands for upper body. We have MB, which stands for middle body. And LB stands for lower body. So in general, UB is going to stand for the head, upper extremities. Medial body is going to be the thoracic spine. Okay, and lower body is going to be the lower extremities and the lower back area. Okay, the difference between the lateral area and the medial area is that the lateral side is going to treat the posterior part of the body, okay, the back, okay, spine, back of your forehead, and more when you have the area here of the brain, it's going to treat more of the occipital brain or the posterior parts of the brain. The medial malleolus, as we can see here, we have the brain, okay, that's going to treat the frontal brain. Upper body is going to be the upper trunk, upper extremities on the anterior side. Medial body is going to be the area of the chest down to below the diaphragm. Lower body is going to be the lumbar down to the lower extremities, okay, and the anterior muscles. Okay, that is the difference between them. Now, these points, actually the location of these points, if we have the malleolus, okay, I'm going to my drawing board again. I like this drawing board. Okay, what I want to do here is draw out the borders of the malleolus, okay, so we can locate them. This is the borders, okay? Now it's in a 90-degree angle, but direct below, okay? So this is around the area of bladder 59, 52, okay? And then you have here, you have the plantar fascia, okay? Just above the plantar fascia, okay? Plantar fascia and the calcaneus bone, you have the lumbar, you have the lower body, okay? Directly below the malleolus, you have the upper body, and in between the two, you have the middle body. Okay, so that's those points. Okay, for example, here, if we go to the medial malleolus, so we join now the borders of the malleolus, what we see here. Okay, the plantar fascia, which you see here, as you can see, our calcaneus, can see that the lower body is in between the calcaneus and the plantar fascia. Okay, the upper body is just below the this around, let's say, just the superior to kidney 6 point, okay, and the malleolus. and then we have the medial body is going to be in between the two. Now, the needle in depth for these points is actually quite deep. You're going to insert the needle and try and reach the area around the bone. Okay, so you're going to try and needle the bone. Just the lower body is going to be, you're going to glide beneath the calcaneus muscle and the plantar fascia. And you're looking at about something like that of depth of a needle on the lower body, where you're looking at something like this, about half a tsun on the medial and upper body, where actually in the area of the brain, you're actually looking at, I think, maybe a quarter of a tsun. Okay, so those are those points. So we will just have a video here to show you out these points. Okay, so as you can see here, we're gonna have here, we have number one, that's the brain. Okay, we have the lateral malleolus here. Okay, we go 90 degrees. So right below the malleolus, that's the upper body. Okay, see a 90-degree angle. That's in between the plantar fascia and the calcaneus. You have the upper body, and in between the two, you have the medial body. Okay, so you have the area. So like I said, you have the area here, right in the center of the malleolus, then right below the malleolus, you have the upper body. Here you have the plantar fascia. Here you would have the calcaneus, you have the lower body, and in between the two, you have the medial body. Now, I forgot to mention that I like to use these points for any kinetic or movement disorders throughout the body. They're more used for that, I found, and for pain. So I like to use that a lot. And sometimes in those cases, you can actually kneel superficial and then do your workout. The patient can do his workout. So I would recommend, if you want him to do his workout or some exercise at the same time that the needles are needled in, could be Qi Kong, Tai Chi, sorry, Doin, you can just use press stacks in those cases and then work with them. Okay, so that's the lateral malleolus area. Now we go to the medial. So again, the center is going to be the brain. Okay, and just below the malleolus is going to be upper body between the plantar fascia and the calcaneus upper, and in between the two is going to be the medial body. So now just to observe how the needle in. Okay, so I'm just looking for sensitivity. I go to the lower body. Let's say I have lower abdomen pain. Look for a tender point there, and then insert the needle into the tender point. As you can see, I'm going quite deep there with the needle. Okay, that is the needle. Okay, I can even go deep. I'm just pulling it out. So that's those points. Okay, now, so that's the first point. There's another alternative area for these points, which was actually the first somatotopy that I was using for a couple of years, and also it was used by Dr. Toshikatsu Yamamoto, is the area of the malleolus. And as you can see, the zones here are parallel to right around the malleolus. Again, the same idea here, that you have the medial malleolus is going to treat the anterior body, okay? The lateral malleolus is going to treat the posterior body. As you can see, the zones here, which can have zone 1, zone 2, zone 3, okay? Here you have zone 4, 5, and 6. Here you have the images with the areas in which they cover and which they treat. For example, zone number 1 is going to treat the area here that you can see here in red, okay? The medial parts of the body. So you could say it's the kidney channel, okay, together with the Ren channel, okay, and the heart channel. Okay, that's what you're going to, zone number 1 is going to treat any disorders throughout that, okay, with musculoskeletal problems, okay, all the organs nearby. For example, if I'm in heartburn, it's going to treat the heartburn, okay? Zone number 2, as we can see here, zone number 2 is color of the body. That is kind of spleen, stomach, till the overlapping towards the large intestine. Or as we can see here pericardium, and mainly the channel of the pericardium, and maybe lung, slightly lung. Where you have zone number 3, it's right here. You can't see it very well. It's right on the sides of the body. That's the overlapping between the gallbladder channel, the area where the spleen channel would meet the gallbladder channel, the lateral anterior part of the body. Okay, and then we go to zone number 4, is actually what we see here in green. Okay, as we go up, it's right, the meeting point, that's the gallbladder channel. With on the hand, as we can see, it is the lung, the mixture with the lung channel. And then we have what we see here on yellow, okay, as you can see here, is actually the bladder channel, okay, and maybe large intestine channel, the yang channels. Okay, that's number 5. And number 6 is the medial part, the posterior part of the kidney, and towards the Ren channel in the back, or the Quattro Giagi, and the medial parts of the bladder. Now, what is important, this is already the connection between fascia and the temporal region and the area of the ankle. Now, the needle in areas are very, very superficial. Now, just to make it a lot more understandable, a lot more easier to think about it, if we have a trunk, okay? I'm going to draw out a trunk with these points. If I'm having, let's look at this as a human body, okay? This is the center. Okay, this is for example, the posterior part. So as I go, number 6 is gonna, as I go number 6, I'm right on the do channel, right? The edge of 6, which you see here, is the do channel. And as I go with from my posterior part of the ankle to the medial part, I'm actually covering 6. This is gonna be 6. And if I take another color already over here, I'm gonna be, sorry, different color. I'll be coming towards the area of 5, for example, and as this is on the trunk, and as I go more and more distal, I'm going towards the area of 4. I'm actually covering towards the lateral posterior part of the body, and then it starts curving around, and I'm going into the yin. So then I'm on the yin aspect, or the anterior aspect. So the anterior aspect will be a drawing like this. So again, I'm coming from that overlapping of the yellow. Okay, so I'm coming from the area here of 3, and slowly going, I'm going more and more posterior. So I'm going inwards. Okay, so we go into there, and then we go into the area of the red, because we're going into area number 2, and then right in the center on the linea alba, we're going right into number 1, the edge of number 1. Okay, so that means the most, always remember that areas 1 and 6 overlap. 1 will be here, 6 will be overlapping it in the posterior part of the body. Okay, number 5 will be, 2 will be the anterior, posterior will be, as you can see, images 1 parallel to the other, 6 will be parallel to 1, 2 will be parallel to 5, and 3 will be kind of parallel to 4, in the same areas in which it covers when you treat in the body. Now, the needle in here is very, very superficial. Okay, it's very superficial. No, not necessarily you need to needle very, very deeply, but as you can see in the image here, these are the planes in which it cuts or treats. Now, that's very, very interesting. Speaking towards what we're going to speak about tomorrow, that fascia trains or anatomy trains, you can already see the connection between working on the ankle, how in the end, by treating points in the ankle, you might affect the temporal, and you're working with points on the temporal, you're going to have an effect on the points on the ankle, and also the areas in between the two. So basically, that's our discussion for today. I hope you found these points very, very useful. Oh, sorry, I'm going back. I forgot to mention that when we going back here, going back here, I want you to, the needling is very superficial, but at the same time, you palpate the point. You just start looking for sensitivity. For example, if I'm having pain on my spine, back spine, I palpate the area of number 6, very close to the bone. Okay, and then I needle that area close to the bone, and I found sensitivity, and the patient feels better. The same if I'm having, let's say, pain in my upper chest, I can go to the area, for example, of number 1, palpate there, and slowly curve my hand towards number 2 zone. And when I found that a sensitive area, and the patient even feels now that he can breathe better, for example, in his chest, I can needle that area, and I needle towards the malleolus bone, very, very superficial. One thing again I forgot to mention, that over here, basically in this point is bladder 6, and on the medial part here you have about kidney 3. So those kidney 3, here you have liver 4. So you're right in the center of the malleolus, the most posterior and the most anterior. The same here, you have kidney 3, bladder 6, and here just a bit higher, superior, about to gallbladder 40. So you're going to have the center of the malleolus, where you carve the malleolus in half. That's going to give you your zones. Just to draw it out for you again. So if we have in my malleolus, okay, that's my malleolus. This is the part of my center. Okay, this is my malleolus, and this is a part of the center. So this will be zone number 1. Now I'm starting, okay, that'll be zone number 1. That'll be zone number 2. That'll be zone number 3. Same, you have zone 6, zone 5, and zone 4. Okay, so those are our zones. Okay, so those are our points and our discussion for today. I hope you found it very, very useful to use in your clinic later on today or even tomorrow. Thank you very much. If you have any questions, feel free to contact me. Here you have all my email information and my website. Thank you very much. Have a good day and keep safe, all of you.